C5, C6 disc bulge, diffuse disc bulge at C5, C6, and reversal of cervical spine curve. What exercises can be done? Welcome to today's episode of Ask Dr. Walter Salubro, episode number 20 videos in a row. Each day, I'll pick a question from the comment section of my YouTube videos and my channel, and I'll feature that question in this short video segment. That's what this series is about. It's called Ask Dr. Walter Salubro. And today I got a question by Jenya, and Jenya asked a question about exercise related to C5, C6 disc bulge and reversal of cervical curve. So let's get into the question and then let's get into the answer. Here's the question. This is what Jenya asks. Hi doctor, my report says I have mild reverse lordosis of cervical spine, C5, C6 intervertebral disc mild diffuse bulge causing ventral thecal sac indentation. No significant nerve root indentation. I've seen a lot of doctors. Still I have pain in the neck and mild low back pain. Is there any exercise? Great question, Jenya. So there's a lot to actually break down when it comes to answering this question. So let me get into it. Let's look at what normal is. Okay, so a normal cervical curve approximates the shape of a circle. It's circular in shape, okay? It's been validated by spinal research and computerized spinal models. So we know that's what the ideal curve of the spine should be in the cervical spine. An ideal shape is a C-shape circular curve, okay? So you want to be as close as possible to that circular curve to have a healthy spine, no damage on the discs, no pressure and discomfort on the nerves, and no pressure and irritation on the spinal cord in the cervical spine, okay? So when there is a reversal of the cervical curve, that means that there is a kyphosis there. So kyphosis, a cervical kyphosis, is a reversal of the cervical curve. So how does that relate to disc bulges and pain? Well, when the cervical spine is reversed, it's now offsetting the load and weight distribution of the head on the cervical spine in the wrong direction, which now causes irritation on those discs, cause them to break down over time, eventually bulge. And when they're injured, they cause pain and inflammation. When they irritate the nerves, they cause more pain into the arms, tingling, numbness. Okay, so in this case, there's none of that. Okay, just seems to be some neck pain. Okay, neck pain and also mid-low back pain. Okay, so that's the connection between the alignment, reversal of the cervical curve, and also the disc injuries and associated pain. We also know from spinal research that if there is a decrease in cervical curve, so let's say a straightened cervical spine or a military neck, so not a reversal, just a decrease, there's a 2 times correlation to neck pain and disability. When there's a reversal of the cervical curve, so cervical kyphosis, there's an 18 times correlation statistically to neck pain and associated disability due to neck pain. So it's a serious problem that needs to be addressed. So there's obviously things that can be done, medication, injections, if it's really complicated and unstable, possibly surgery. But really, we're talking about things that need to be done to correct the alignment, okay, and reduce the kyphosis, reduce that reversal, which is an abnormal cervical spine, and improve it into a better position. And one of the best exercises for that is called extension traction, cervical extension traction, okay? There's a couple of different types of that. We do it in our office all day long. I just finished my day today. I had a busy day, saw many people, and I had many people in cervical extension traction, correcting their cervical kyphosis, their military necks, their straight necks, their loss of cervical lordosis, right? So it involves placing them into a traction unit where their neck is being extended back and we're inducing a curve into the neck, okay? So that's done in the office with a corrective care chiropractor. As well, we can send people home with a cervical Deneroll or cervical traction device. Hold right there, I'll show you one right now. Got it right over here, okay? So here's a cervical traction device, okay? Called a cervical Deneroll, under the neck, back, like that. And that will help to induce a cervical curve as well, help reduce that kyphosis. I have several videos about this on my channel, so I'll post them in the links in the description below. And then there's other exercises that are supportive to this, like mobility exercises, stretching exercises, isometric resistance and strengthening exercises, decompression style exercises, a variety of different exercises that can help, okay? So I can't get into all of that, into describing how to do them in this video. It's more of a general discussion, some things to look into. a great person to talk to in terms of professional will be a corrective care chiropractor, someone trained and certified in chiropractic biophysics as myself. So if you're looking for a referral for that, and this is for everyone, right? This is just a general response. I'm not giving specific advice or recommendation to any particular person, including over here in this question. But if you're looking for a corrective care chiropractor, just comment below and I'll send you, refer you to a directory of certified and also trained chiropractic biophysics chiropractors and doctors like myself that do this kind of work in their office, or at least are trained to do this kind of work. Okay, so that's the answer to today's question. There's a lot in there. I talk a lot about this on my channel, so do look at some of the other videos on my channel. I'll put some of them in the description below, and that covers episode number 20. So if you have any comments, questions, or thoughts, I would love to hear them. Leave them right now into the comment section below. Throw some thumbs so the YouTube algorithm can put this out in front of more people. Some thumbs up. And of course, if you're new to this and you want to see more of these videos, just subscribe, become a member of my channel. I would love to see you follow my videos. I do also put other video tutorials out there as well. You can check my channel. You see a ton of them on the cervical spine, the lumbar spine, thoracic spine, corrective care exercises. You get a ton of these videos, okay? And if you've missed the other episodes of the Ask Dr. Walter series, this is episode number 20. So if you want to catch the first few ones, there's lots of great answers and questions in there. Just go to this playlist right there. You see that playlist right there? Go there. You can watch them all, just binge watch them from 1 to now, or you can pick and choose some of the topics that you like. But either way, the playlist is right there.